As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road. Let's camera action, I'm ready to go.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
We're going to actually start clapping right now. First of all, I'm one of those people that are very excited when Tom gives us the opportunity to use his platform for serious conversations that we have in the community as it relates to you. People that look exactly like me and people that work in this community that are Black and brown individuals that are trying their best to figure this thing out as it relates to COVID. I'm one of those people that want to give people the truth. And we are still in a very serious pandemic that hasn't gone anywhere. And if you notice, our communities are starting to draw back to what they believe is a form of normalcy that is not normal. We are not back to normalcy, my people. That's why I labeled the title of this show, Murder is the Case That They Gave Me. I took it from an old Snoop Doggy Dogg song back in the 90s. It's a very serious title. When you say murder and you use the term murder, it's very serious. And we look at it in a way of something that's serious. COVID is a murderer. And we need to give it a case of life and give it the death penalty. That's how serious that it is. And a lot of times when we don't look at it like that, it really impacts the way that we live our lives in this community. Our communities are already filled with disparities that we need to focus on in order for our communities to be able to have what we want is normalcy, to be able to go outside and play and let our kids go wherever they want to go and let us go wherever we want to go. But until we put a serious stop and take this thing seriously, we're never, ever going to be able to get back to the things that we need to deal with. Economic development, cleaning up our neighborhoods, bettering, when I say clean, I mean planting grass and being able to cut your grass and being able to detail your homes and have your home just as beautiful as anybody else's, picking up the trash, looking back out for one another as they did in the 50s and 60s and early 40s and 20s when Black people and Hispanic and Latinos and of all areas were able just to function and enjoy their neighborhoods. We can't do that right now because we're impacted by this murderer. And until we put this murderer down, we still going to be in the place that we are. I'm still waiting on a few folks, but that's all right. It can't hold up the show. But who I have is some dynamic people that are right out here in this community working for you, not themselves. And we hear the terms that, well, you get paid to do what you do. Well, if I get paid or not, it's still the work that I do. It's still the work that needs to be done. It ain't about the money, it's about the work. And so before anybody says that, I want to say, hey, we here for the work, regardless of how we're compensated or not compensated. It's about the work, and it's about changing the mindsets of people. So I'm just going to allow my friends and good people to come on and introduce themselves. I'm going to start with this. I got to start with this person that I believe is the reason I sit in the position that I sit in. I had the chance to work with Alder Devin, the first year before he left to move on to bigger and better things, which you can see to this day. I asked Devin to come on today, and I'm just going to have him take a moment to introduce himself to you all and let you know who this person is that sits before you in the work that he's currently doing in the ward that he runs. Go ahead, Devin.
Well, thank you, Bernard. Thank you for such a gracious introduction. Thank you, Tom, and 103.5 WNHH for always being such gracious hosts. As Bernard said, my name's Devin Absalom Smith. I'm the Alder of Ward 20 here in New Haven, proudly serving Newhallville and New Haven at large, activist, advocate, and a good troublemaker.
I like that. A good troublemaker. Trouble comes, but it could be good trouble, bad trouble. But I believe he's on the good trouble. So, and then, I bring somebody that I never would have met if it wasn't for Carla Estelle Bragg with Cornell Scott Hill Health Center, who hired this young lady to come in and help with outreach. When you see people walking the communities from Cornell Scott, and now actually she's a new care employee, but still very much involved with Cornell Scott. I had the chance to work with her intensely over the last 8 months of 21, 22. And I got a chance to see the talent that is awesome in this young lady. I'm very surprised, be honest, that it took us this long to bring her to light. And now that she's a care employee, I'm definitely going to expose her to you all. So when you see people walking the community, them blue jackets and light blue jackets from Care and Cornell Scott, is being led by this young lady. And I'm gonna let Tani just come on and just tell you a little bit about herself.
Yeah, I'm also, thank you, Bernard, for that. I'm going to bring you everywhere I go so that when I walk into a room, you can introduce me. As Bernard mentioned, I started out, doing outreach with Cornell Scott, and it's been an amazing journey, like talking to people out in the community, getting to see and hear and feel like what people are feeling about what's going on right now has been really eye-opening, and it's meant a lot to me and to the team, both of the teams, to be able to do this work. And I'm excited to keep going here.
And she is. And that's why I say expose. I know this is kind of the first time that we put her out here like this, but I think this is the very thing. Tom definitely is my man. I appreciate Tom Ficklin for who Tom is. And when I met Tom, it just took me in right away. He didn't waste any time. And it's because of Tom Ficklin that we are able to expose you to this murderer. And I appreciate Tom for every conversation that we get a chance to witness on Facebook Live and so many other venues that Tom is part of. So Tom, thank you once again. WNHH 103.5 FM has allowed us to do this for you today. And I'm hoping that when we walk away from this, that you really understand more about this murderer that we have out here in our community, a sneaky one too, because every time we turn around, they call it mutation. It constantly is mutating and creating different variants of itself to keep us hostage. And so today we're just going to have an open conversation and kick it. If I can say the word kick it on the channel, but I just like to keep it real. I work for CARE. My name is Bernard Macklin. I am the Vaccination Outreach Education Coordinator for CARE. My job is to bring information as it relates to this murderer to you, and to help you understand. It ain't about government. It's not about it's not about black and white. It's not about color. It's about people being harmed from every area of this community. And I don't want us, and I say Latino of many ethnicities. I don't want to leave anything out. I made that mistake, I believe, the last time I made reference to one, and it didn't fall too well with the other. So I'm just going to say any area of Hispanic, Latino, Haitian, Jamaican, whatever it is, India, people from India. I don't want to leave anybody that's of black and brown shade to be left out of this conversation, because this conversation involves us. And I want to come on today to tell you, we need to have conversations of how to remove disparities in New Hallville, in the Hill, in West Rock, wherever people dwell, because as long as we're breathing air, this mutated devil is going to be present. So, so just let me jump right in. Can I jump right in, y'all? Y'all don't mind? I would like to ask a question, and you know what? I'm gonna throw this to Devin real quick, because you're in a very serious position as it relates to changing the scope of how people see the New Hallville community. And it seems like the New Hallville community is constantly coming out of people's mouths. And I know you're working very hard in that community to change. Why do you think it's so difficult for people in your ward and people just in New Haven in general, why do they have such a hard time talking about COVID and the seriousness of COVID? Why do you think that is?
Well, Bernard, if I could surmise a guess, I think that there is a number of things. One, it's a really sensitive subject because it is, like you said, a murderer, if we want to characterize it as that. So it's something scary. It's also something that's pretty foreign to us. And then many people have been deeply impacted. So, in any type of situation where we're affected physically, emotionally, and otherwise, it's hard to discuss. And I think a huge component of that is education, information, some of like the critical work that you all do. But I want to, speaking of education, speak towards some of the data. Governor Lamont's update on CT's coronavirus response effort shows that as of 3 p.m. yesterday, with data from the past 7 days, our test positivity rate is at 13.24%. Now compare that to the same day, May 12th of last year, the test positivity rate was 1.5%. So yes, this is something that we should talk about. And then also briefly, patients currently hospitalized as of yesterday was 291, which is up 58 people in the last 7 days. Compared to last year, it was 243, and it was down 28 from last year. And also, out of the 291 patients currently hospitalized with laboratory confirmed COVID-19, 102 of them, which is 35.5%, are not fully vaccinated. And just to speak really briefly too about like those breakthrough cases of people who are vaccinated, the Connecticut Department of Health is reporting that as of May 11th, a total of 2,632 cases of COVID-19 among fully vaccinated persons in Connecticut have been identified. So those cases account for 7.58% of the 2.7 million people in the state who are fully vaccinated. What does that tell us? People who are vaccinated are getting it, but at a lesser rate than those who are unvaccinated. And most importantly, the numbers are very high right
now. and you know what? That's why we're taking the position at CARE. Not to say that we still shouldn't focus on the people that are not vaccinated, but to keep our communities healthier, we need to focus on those that are vaccinated, that are not getting a booster, that only got one dose, or just stop with the first 2 doses of either Moderna or Pfizer, or just getting the 1 dose as I did with Johnson and Johnson. I have gotten all doses at this point because I understand the importance of it. Denise, you're out in the community a lot, and you got your teams out there passing out information constantly. Why do you think, as you heard from the numbers that Devin just gave us, why do you think, people are still so hesitant just based on the things you've seen since you've been out there?
I think one thing, like recently, is a false sense of security, because the numbers were so low. People thought, nah, it's fine. Like I don't even need to get it now. Everybody already got it. So I'm good now. But with it, with things going up, we're helping to educate those that don't know that is not the case. Exactly, what Elder Devin just said is happening. Things were good because people were masked and, getting vaccinated and doing the 6 feet apart. And now we're all getting back together again. People are celebrating it, like graduations, it's birthday season, like all these things are happening where people are now coming back together and everyone's getting sick. And so it is like, really important that because people are still getting sick, we can't just act like it's not here.
Act like it's not here.
Yes. And that's, that is something that unfortunately, like some people are feeling like, because maybe they haven't personally been affected yet. They've been one of the lucky few, right? That they haven't maybe lost someone, or maybe they did, but it was in the beginning and nothing has happened recently. So they do again have that false sense of, it's okay.
I like that. And the thing is that people probably wonder why do I use murder? We deal with murder in a different way in our communities too. And we still have that same frame of mind when it comes to when people are killed in our communities with this silence and just accepting it and allowing it to continue. We have to get to the standpoint where we put people that commit murder where they need to be in their rightful place out of our communities. Because I want to feel free to walk out my doors. And because my job is dealing with COVID, I want to treat it like any other murderer. I want you out of my community so I can come into my community and be free. And we need to really remove that. People, I heard some things from Tani and Devin that really still concerns me, even to this day. You know, taking away preventive necessities. You still should be distancing yourself. I know I want to give people hugs. I'm a hugging person. I want to come up and hug everybody. What's up, dog? You know how we do it. Come and get that little false hug and the tap on the back, or see your friend and give them a hug. But that's dangerous. That's so dangerous in our communities based on the data, the facts, the results that Alderman Smith gave to us. Just now you heard, those are facts. That ain't nothing made up. That's what's happening in our epidemiology report that we're receiving. This is real information, people. And so you need to take those facts that he just gave. How do we, so Devin, how do we help folks, you know, to really understand the information you just shared? How do we help them to really understand and take away their doubts? What are some of the things you believe that we should do to remove the doubts that people currently have?
I think the process is going to be ongoing and evolving, but I really believe that it's important to bring information to people in a way that's palatable, a way that is in a form of communion, where we all understand one another. And so when we're distributing either written information or having conversation, making it relatable to things that folks talk about and do in their everyday lives. And I do want to emphasize too the point of how Hispanic and Latinx and Black people are disproportionately affected by this virus. I mean, if you'll allow me to just say a little bit. So the Kaiser Family Foundation reports that there are persisting disparities of cases for Hispanic people and higher deaths for Black people. For example, Hispanic people represent a larger share of cases relative to their share of that population. So in numbers, they represent approximately 24% of the cases of COVID-19, but they only represent 18% of the population. And their share of deaths, though, is a little closer. They represent about 17% of the deaths and 18% of the population. Now let's look at how this is affecting Black people. Black people represent about 13% of the population, but represent about 14% of the deaths from COVID-19. This is national data, nationwide. And this pattern has been consistent since October 2021. So we're talking about from October to now, this heightened amount of illness and death among Black and Hispanic people directly related to COVID-19. So that's something for us to discuss. And I think that, like I said, I'd like to, and I'm constantly working on finding ways to discuss it. Like we talk about things at family dinner.
And we need to, like, you know, because you think about even bringing that up as a point, you know, we've even removed ourselves from the very thing that made us the people we are and the connections that we have to our families. Is actually having those gatherings at the table. And now we're so afraid, or we just remove the thought of even having it, if COVID goes here or not, removing that specific aspect of family away and sitting at the dinner table and having those real conversations, the backyard barbecue conversations, the barbershop conversations that we removed. And now that COVID is still, as you mentioned, the percentage, the increase of people positive, that's testing positive for COVID has increased in this community. You know, in order to get back to those type of conversations, I'm going back to the title. Murder is the case that they gave me. We need to remove this virus from our community so we can have peace and table conversations. Tanique, I like what David just said. You know, when you think the things that you've gone through in the last 8 months of your time in the community doing outreach, you know, where do you find why folks is doubtful? I mean, some of the reasons why you think folks are doubtful.
A lot of misinformation, unfortunately. You know, a lot of misinformation that went out in the beginning that people still are believing. And, you know, as, you know, it's really hard to change someone's mind once they've decided, or, you know, like they've heard something and they've decided that to be true for them. So just constantly, you know, reintroducing, and as Elder Devin said, in a way that's, you know, palatable to them, like just by saying like, you're wrong isn't going to work, you know, just constantly giving correct information and, you know, facts behind it. Other things are some people not knowing, like language has definitely been a barrier. A good thing, like you know, my team is, you know, Hispanic and being able to do that, but that's just one language. Like, as you mentioned, there's so many other, you know, languages spoken in our neighborhoods. So they may not know that the vaccines have been free for this whole time, you know, like had been free for this whole time. They may have thought they had to pay for it. We making patient calls, we've learned some people did think that they had to pay for it, or that they owed money to, you know, to their doctor or to their, you know, health center or something. And they were afraid to go and get the vaccine because they thought they would have to pay their bill first. So just a lot of misinformation in different ways, in different areas, that have prevented some people from, you know, getting vaccinated and protecting themselves and their families.
She brings up a good point, Devin. And you know, when she talked about the cost to our communities, and I know you've worked in Hartford for a moment before actually pursuing your candidacy for alder and actually becoming an alder in Ward 20, which I'm very proud of you about that. Trust me, I am. But how are we working to help our communities kind of reduce possibly the cost of being vaccinated?
Well, I think just kind of to echo what Tani, am I pronouncing your name correctly?
Tani.
Thank you. What Tani said is most things are free. If we look to especially clinics like Cornell Scott and others, they provide a wealth of information. But what I would suggest to residents, any resident of New Haven, is if they do have questions, call at 211 or go online, and they'd find really a wealth of information about either free opportunities or cost-saving opportunities through their insurance.
You know what? I'm just going to throw this out there because I'm part of the team as well. You know, definitely go to Cornell Scott Hill Health Center. It has multiple locations throughout the New Haven area, in the Valley, down in Ansonia, Derby. Definitely check them out. You got the Fairhaven clinic over in Fairhaven. I love them as well. The work that they're doing in the Fairhaven for the majority of the Latino Hispanic communities over there in Fairhaven. Our own, proudly to say, our own New Haven healthcare facility, health department here in New Haven definitely has multiple places you can go and get vaccinated. And from what I'm hearing, they're not going to charge, even though there is a charge for getting tested now in some places, and there is a charge now to get vaccinated in some places. They're not charging anybody. And so I'm glad that they still feel the necessity to not cause even more harm and cost to a community that's already struggling financially. And Devin knows that because he lives it every day in the work that he does and the work that Tani does and that we do. So go check out those places. Griffin Health, I'm not the movie Griffin Health that works for the state and DPH, is still involved all through the state of Connecticut in different places. I want to leave them out of this conversation as well. But the thing is, it's a conversation, and we want to make sure the conversation leads to movement. that people are moving to get vaccinated. You know, that leads me to a point of vaccination. How do we help from the work you do, Devin, and the work that you do, Tani? How do we help people to still understand that vaccination in itself is still important?
Like education really is the key, like continuing to get the information out there. It really.
How are you doing that? How are you getting that information out there, Tani?
So literally we are going out in the communities. We have in the past, we're not knocking on doors currently, but literally knocking on people's doors and with information, asking if they have any questions, being able to answer the questions best we can, and if not, like referring them to the agency where they can get that information, or giving a number, and we'll get back to them with the answer that they need. We are out in the community, just like walking. Literally yesterday, we were walking down Whaley. We were out in Dwight, walking the streets, talking to people that we encountered, handing out information. There are many clinics in the month where we're not only giving vaccinations, doing other health services, and like giving information. It's all about providing the information and education, answering any questions that anyone may have. And like the billboards that you see out there. I personally do not do that, but like Cornell Scott does do that. They have radio ads, TV ads. It is, everyone is just trying to still get the information out there to educate people, as much as possible, so that they can make the best choices for themselves. And
what? I made a mistake, people. In my introduction to those that are out there, I do not want to leave out Yale. Yale is very impactful in urban communities and doing the work. I have good friends over at Yale that constantly we've been working together since I've been in this position. And I know they're doing great work as well all throughout this community. They're one of the bigger giants in this community and have been since they've been in New Haven. I definitely want to show the love to Yale, and please forgive me for not acknowledging that in the first place. But yes, definitely Yale is one of the big giants also in this movement as we're trying to get rid of this murderer in our communities. Devin, that's a good point. Still, how do you see, when you out in the community doing other projects and you find it hard sometimes because of the restraint of being distant from people because of COVID, how are you convincing your community and your ward to actually get vaccinated?
Well, I want to go back to really conversation.
Sure.
And then at community events and other things that occur, making sure the information is available. But I definitely want to say that I have to acknowledge I respect choice. So, just to address kind of the elephant in the room in a way, not everyone is going to get vaccinated. And some people can't get vaccinated due to various health conditions or issues that they might have. So along with emphasizing for those who become informed and educated, making the decision if they choose to become vaccinated, I really try to stress within the community, let's also practice these safety measures of hand washing, social distancing, and masking. Because the choice does ultimately lie with each individual person. But my hope is that when folks are presented with clear information that they can understand, then they'll be able to, along with public health experts, make the best decisions, not just for themselves, but for the impact that it has upon their neighbors as well.
Wow. And people, and let's let me be apologetic if I mess around, because I get really happy when I get opportunities like this and I miss some key points, but I'm so glad that this is open to people to help us to make comments. We're not all the experts, but we're just a few of the people in the community that really want to emphasize for all governmental agencies, for all local agencies, especially good friends of the Community Action Agency that are doing fantastic things in multiple areas. I don't leave them out, but it's just to really try to get to the root of how we can get rid of this murderer, and whoever it is that's part of this journey. If I don't mention your name, that don't mean because I meant to miss you. I'm just excited to have this conversation. And I know we have to be careful because of a lot of other reasons, but definitely know that you are in my heart and mind, because with this thing, I'm serious about it. I'm serious about it because a person that came down with COVID, and what really helped me most is that I was vaccinated. And I got pre-existing conditions. I'm diabetic. I'm not afraid to put it out there. And I think about people with diabetes and how devastating diabetes and so many other medical conditions out there that COVID can really cause harm to you. And I was so happy when I caught COVID, it was just a cold. You know, yeah, I had a sniffy nose and a headache. A lot of the really conditions of COVID I missed. And I'm so happy to say that. And I've gotten both vaccines. I've gotten both boosters. I'm 55, so I was eligible. But I went and got both. And I want people to really understand some of the things that they're sharing with you today is so important. And these are people just like you that really understands the importance of science. That's public health, to really understand the importance of science and believing the science. Or if you struggle with that, and don't beat me up if you see me in the community for saying this, just having common sense. That's one thing that I believe in my faith that God gave to all of us, is the ability to reason and think things out. And I really want people to really take what Devin said, you know, to be able to reason and think this thing out and understand the importance of looking at the data, looking at the numbers, looking at the things that he provided for you so early in this conversation, and taking that in and knowing that is real. And that you should take that really seriously for not just you, but when you look to the side and see your husband or your wife, and you look to the other side and you see your children, and then you look in front of you and you see your grandparents, your uncles and your aunts, people very dear to you. And then take it a little further, you see people in your neighborhood, and you see people in your city, and so forth and so forth. You know, I'm just curious. What do you believe? Either one of you can answer this question. What do you believe if we don't get a hold of this thing right now, today? What do you believe our future will look like?
March 2020.
You know, and Devin, you gave some straight up facts, man. You gave some straight up facts when you increase numbers. So when you're thinking of future, you know, when you're thinking of all the things, all the plans and goals you set for your life and things that you want to do, and even in your authorship, you know, things that you want to do as an author to improve your neighborhoods. If we don't get rid of this murderer, how do you see your future?
Yeah, I mean, it's challenging. I want to go back and re-emphasize that last year, yesterday, we were at 1.5%. This year, yesterday, we're at 13.24%. I feel like I'd be remiss in saying that this murderer, as you know, we're naming it, has an accomplice, and its accomplice is the social determinants of health.
Oh,
high blood pressure, diabetes, obesity, that disproportionately impacts people of color. That accomplice put it right alongside its friend, this murderer, COVID, puts us Black and brown people in a very precarious place. So as far as what I look to the future, I hope and I do believe that we'll be able to come together to support one another and really understanding the importance of this moment and how the decisions we make regarding safeguarding our health, like you said, applies to ourselves, but also to our loved ones, our neighbors, etc. I think the future, I'm an optimist, so I always am thinking the future is going to be bright. But I think that this portion we're in here, this trial, is where we really have to put the work in to remind ourselves about what we need to do to keep ourselves and our neighbors healthy.
You are people that's on this call today. He said it very, eloquently. I can't take it away from the words that he used, you know, and the thing that I love most out of everything he said was support, that we will support each other. That's deep. That is a really big word when it comes to our communities. Support. Is skip them mugs. I don't know them mugs. I don't care nothing about them. I don't care nothing about them. It's all about me, dog. No, it's not. It's all about all of us, every last one of us. Getting back to the way that we did when we were really fighting for our freedom, and we was really fighting for fairness when it comes to having opportunities. People were marching, dying, getting bit by dogs and sprayed by fire hoses. So y'all don't know anything about that. But ask your grandparents about it. Some of you ask your parents about it. They were there. Ask your parents about being bit by dogs for just being on the street at the time that this was going down. You had nothing to do with it. But you still were beat. You still were bitten. You still were sprayed. Some people were actually shot and killed, hung. We don't know about a lot of that. So we have to get back to where the people that went through all of those things, that we're supporting them still right now today with this pandemic. This is a killer. It's a murderer. And I wanted to come out and say that to know how serious this is. I don't want to call it sweet. Oh, it's just something that just happened. No, I want to tell you what it is. It's a murderer. It's harming us at a significant rate. To me, you're still being fairly kind of, being, in this work, when you think of your future and you look at your babies that's next to you, you look at your family, or you look at your workers, or you look at your communities, where do you see, this thing as it relates to your future and the future of the work that you're doing?
It's really tricky, right? Because I feel like it, things have come in waves, right? As we heard, right? Things go down, everyone gets kind of comfortable, and then it goes back up. And it's like, oh, wait, we got to fix this. So then it goes back, everyone masks again, or just distance, and, kind of goes back down, and then it goes back up. Really, we need to get it to a point where it is like the flu at a minimum, to where it's like the flu, where we can function, and people aren't hospitalized at the rates that they are. People aren't dying at the rates that they are. To at least get it controlled and more managed, so that we can, just go on with our lives and, take care of each other, in a way that is not as harsh as not harsh is not the right word, but I like
that word, harsh.
Right. Well, I don't know. I don't know. It's just very.
It gets tricky.
It's possible. It's possible. Yeah. Everyone just needs to get on board, and at the same time, and do it, so that we can get back to, quote unquote normal. But everyone needs to do their part in order for that to happen.
Oh, that's a big word too. Everyone needs to do their part.
Yeah.
And a lot of times, I'm gonna be honest with you people that's watching this call, I think of collaboration. Devin, when you think of that word collaboration, how is that important to the work that you do? How is it important that you know who your resources are, who you can reach out to and collaborate and help you with this work?
Entirely important. As soon as you said the word collaboration, I had like the flutter of fire in my belly. It just like a furnace turned on. Because we have so many dedicated community partners. I won't go down the list, as you named so many of them, that we have as resources to help us, to assist us through this tough time, including our neighbors and friends. It leads me to reflect back on the beginning of the pandemic. And there's a reason that I risked my life at the beginning of the pandemic, going door to door and doing food distributions. It wasn't anything I did by myself. I couldn't have accomplished anything were it not for the dedicated neighbors, community members, community leaders who decided to care about themselves, their family, and their other community members. It reminds me of a quote from John Donne, which I often cite, which is, "No man is an island entire of itself. Any man's death diminishes me. Therefore, never send to know for whom the bell tolls, it tolls for thee." So if one person loses their life, any person that's losing their life or is sick and suffering from COVID-19, that affects me directly. And I want to ask, you all, and ask the listeners, think about how many people you know who were affected by COVID, who got it, perhaps who passed away from it, perhaps you got it, maybe even multiple times. So I think that we should all just kind of reflect on that and know, though, that we're not alone in this. We're all in this together.
You know what? That's a big word. Every time y'all talk, you give me big words, that we're not in this alone. I don't want to be alone. You know what I mean? I'm just one aspect. Devin's just one aspect. Tania's just one aspect, but we need everybody. And I'm going to go back to that big word of you, support, being supportive with each other. And it ain't about government. It's not about power. And a lot of times it's because of those things why we don't collaborate. Everybody want to be the leader. Sometimes it ain't about just being one leader. We have multiple leaders in this community. Some of them living right there in New Hallville. Some of them living right there in the Hill, West Rock, Dwight. And if I miss one, please let me know. I don't want to miss any of them. I'm not trying to, but I'm just letting you know, I want to see you collaborate. If I haven't talked to you yet, please call me, 860-810-6457. Call me. I don't care about you having my number. I got nothing to hide. Call me. I want to work with you. Let's not be people that's hiding behind doubt and ignorance or looking for something out of this. What we get out of this right now is sick people, sick grandmothers, sick grandfathers, uncles, cousins, people that that has died from this murderer. People right now in the hospital, at Yale Hospital, going to Cornell or going to Fairhaven or the New Haven Health Services, that's going to get services over there right now today because they sick. Those are people we need to think about when we talk about power. We need to think about the people that actually put you in office, that voted for you to help them. We need help with getting rid of COVID. I'm putting it out there, flat out. I need your help. I need your assistance. Devin needs your assistance. Every order, all 30 orders all over this area needs your help. Honda in West Rock. Hey, Honda, what's happening? Honda needs your help in West Rock. Come on, y'all. Let's go on over to some of these places and give a hand and support our orders. Stop making their job so hard that they have to come beg you to help change what needs to be changed. Flat out. We need to step up to the plate and stop going and having these little ugly conversations and ain't doing nothing. I don't like to be part of those things. I want to get rid of this murderer so I can come out my house and feel safe to come out and breathe clean air that God had given to us to live freely on this earth. How do you do that? You do that by what he said, and what she said is support. Oh my goodness. Working together, collaboration. Big word, big word. We're using some big words today, people. We're using some big words, but how we do that is I want to see people bringing this man's phone off the hook and helping him. I want to see people not turning away our outreach teams that are out there to give you information, talking about you don't want to hear that. Get out my face with that. Get out your face with something that can save your life. Help me, please, with that. That ain't common sense right there. That's foolishness, folks. You should be able to want to hear what her team has in their hands to give to you and read it. One thing that I want to bring back I'm a little old, y'all. I'm a little old. I know I look like it, but I'm a little old. I want to bring back something that we used to say when I was younger. And when going to the library was all we had, we didn't have all this technology. Reading is fundamental. What do y'all think about that word right there? Reading the resources that people give out. What is your comments on that reading is fundamental when it comes to this pandemic? I'll go over to Devin.
Yeah, I agree wholeheartedly. Reading is fundamental. So getting one's hands on whatever type of literature or information that they can absorb is extremely important. I also just want to take a quick moment to send a quick shout out and kudos to Maritza Bond, who our director of public health, who really, I guess put the city on her back, and working for us to help keep us safe. And then to reference kind of the comment you made just a little bit earlier, Bernard, about people calling up to begging, like, how can I help? I'll turn it around a little bit too and say, to quote the Temptations, I ain't too proud to beg. I'm coming to you. I do need your help, and I want your help, because all things we do, all things I do in the capacity as an alder, has to be community based and community led. And I want folks to know that everyone can help in some way, and no idea is too small. Even if you're just lending your thoughts about the matter, you're sparking discourse. You're bringing the conversation to the forefront in your community. And guess what? That matters.
It does matter. It does matter. These people didn't take these positions just to have something in front of their name. Our alders are so important to the work that we do in this community, and they need your support, especially with this murderer. When I look at this beautiful face over here, my coworker over here that's out there, I'm telling you, she's out there. If it wasn't for this call, she'd be out there right now. But she's out there. But she needs your assistance. And the thing is that our medical community wants to help you, but they don't have time for the games. They want to help you. And the only way they can help you if you show up. When you hear about fairs in your community, you get information about fairs and clinics. Guess what? I'm gonna be honest with you. Can I be honest, Tom, Ficklin, and listeners? Can I be honest about something? We don't have to be out there. We can be like everybody else and do absolutely nothing, and sit at home and get paid for it. If you just want to go to that, but that ain't us. That's not us. Don't you agree, Alder Devin? Don't you agree, Tani? That's not us. That's not us. I'm thankful to Tom Ficklin here once again at WNAH 103.5 FM. I'm always going to show this man love, and I'm so grateful for him to give us this opportunity to say again, let's get rid of this murder, but we can't get rid of this murderer without you. It's 3 people. I wish I could fill this call up with so many people. We wouldn't have got a word out. That's why I kept it light. But I could have filled it up, because so many people like us is out there. But we need all of us. So when people are knocking on your doors about economic development, changing the communities and bettering our communities, when it comes to medical equity, when it comes to getting rid of all these disparities that we have in our community, don't turn us away, because we're here for you, flat out. We're here for you in every aspect of you. We love you and don't even know you. We love you because we know we love people, and we want to show what God had given us in our gifts and give that information to you so you can change your life. Flat out. I want to change lives, and I'm tired of sitting in the corners being scared to talk because I might hurt somebody's feelings at the top. So what? I want to change and save lives, and I need the help of every listener on this call. If you believe in anything that you heard today and collaborating with your alder right here, collaborating with your outreach administrator over here with Tani, and Bernard Macklin and Carla Estelle Braggs and all the other people out there from every organizations that I'm sorry if I didn't mention you. Project Access, I'm just gonna mention a few if you don't mind. Don't be mad at me if I missed you. But I know you're out there, Fishes, I know that you're out there doing great work to give people food and give them what they need, but we need your help too, to where every time you deliver a bag of food to somebody, when we look at loaves and Fishes, when we look at desks, and when we look at so many pantries out there doing work every day with the people in long lines to get food, give them some information about health equity. Give them some information about how to save their lives when they're out there just kicking amongst the people out there at the green and all over the city, that they need to be careful, and how they do this until we get, as Tani has said, until we get a hold of this thing, until we find a way to control it. Until we do that, folks, it's just conversation. And Bernard Macklin, Devin Smith, Tania Cookson, Mohammed, I had to say that right because I spelled it wrong the other day, but
You said
I just put it out there. I put it out there. I make mistakes still, but But Muhammad and whomever else you are out there, we love you enough to give you the truth. But we need your help to do that. And thank you to Tom Ficklin once again for giving us this opportunity. And hopefully we can come back and finish this conversation, because we've reached a point where we have to kind of bring it in. So I'm gonna give you all a quick second. Devin, if you could just take us out with a closing message to the community that you want to leave them with.
Just really quickly, thank you again for having me. And the closing message, just like it says in the good book, love thy neighbor. Let's keep that in the forefront of our minds as we go on in this journey to bettering our total public health. And I do want to say also really, really quickly, please feel free to reach out to me at ward20@newhavenct.gov or by telephone at 860-778-0051. We're all in this together.
I love that. Tani, take us home.
I mean, how do I follow that? Like, literally, yes, exactly. As he said, do get educated, right? If you have questions, ask. Reach out for help, and do support each other, and just have a beautiful, beautiful day.
You know what? And I'm gonna take you out like this. I love you. God loves you. Tom definitely loves you, because he has this platform just for you. All your organizations in this city, from Yale to the New Haven Health Department to our FQHCs to our smaller organizations that's doing work for you, we all love you. That's why we're here. Take advantage of all the things that you deserve, because you deserve the best. I leave you with that. God loves you, and peace.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road.
This is Harry Drove, and you're listening to WNHHLP 103.5 FM in New Haven.
Yeah, this is my road. Let's